Americans could soon get a third shot of the Pfizer vaccine. That's after a CDC advisory committee voted to recommend it this afternoon. Daniel Hamburg in the ABC 27 newsroom with reaction to that news. Daniel.
Well, Dennis, the FDA approved an emergency use authorization for that third dose yesterday, and today the CDC advisory panel spelled out just who's eligible. The CDC Advisory Committee on Immunization Practices has recommended extra doses of the Pfizer vaccine for people 65 and older, nursing home residents, and people 18 and older with underlying conditions.
When you look at the data for that population of individuals between the ages of 16 and 64, there's not much to support the need that they need a booster at the 6-month interval or the 8-month interval.
Pittsburgh-based infectious disease doctor Amesh Adalja says the process around the booster discussion has been very scientifically driven, in spite of the White House announcing a plan last month to give a booster to all Americans.
The debate upon boosters is being driven because we're seeing some erosion in those high-risk groups, the elderly particularly, and that's what's driving this decision.
Penn Medicine Lancaster General Health is planning to use its primary care network to give vaccines.
We have a number of, obviously, pharmacies that are open to get vaccinations, and we're considering reopening or working on reopening our vaccination center down at one of the health campus buildings.
Chief of Infectious Diseases, Dr. Joseph Contra, agrees with the FDA and now CDC's recommendation.
The FDA, I think, took a wise step to limit it to older population and those who are at risk because of chronic medical conditions. Those are the vaccinated people that we're seeing in the hospital.
The CDC's recommendation will now be sent back to the FDA for final approval. In the newsroom, Daniel Hamburg, ABC 27 News.